Hello, everyone. Good morning, afternoon, or evening, depending on where you're joining us from today. My name is Sylvia Levy, and I'm the Communications Officer for the Agriculture, Nutrition, and Health, or ANH Academy, and the Amana program based at the London School of Hygiene and Tropical Medicine. Thank you so much for joining us today for our second webinar in this series on drivers of food choice in low and middle income countries, a synthesis of evidence. This series is co-hosted by the ANH Academy and the Drivers of Food Choice program at the University of South Carolina. Today's session is about perspectives on food safety as a driver of food choice in low and middle income countries. And we have a slate of great speakers for you to engage with. The third webinar in this series will be on 11 March and focus on changing values in food choice. You can register now, and we will put the link in the chat box. We're also very excited to let you know that the application portal is now open for the call for abstracts for the ANH Academy's annual meeting of our community. The ANH Academy Week will take place online from the 21st of June to the 2nd of July, and we hope you will join us. Please submit your research to the call for abstracts by the 28th of February. We'll put a link with more information in the chat box about this as well. You'll also notice when you go to that link that we have a brand new website for the ANH Academy. We hope you like it and encourage you to explore, update your profiles, take a look around, and we'll be making more improvements in the future, so stay tuned. We also welcome your feedback and any questions you might have. You can just email us. Finally, before we get started, I would like to go over a few technical items so you all know how to participate in the webinar. First, the webinar is being recorded and will be posted on our website. All participants have been muted, but please introduce yourselves using the chat box. Let us know your name, where you're joining us from, and the organization you work with. Please also rename yourself in the Zoom call with the name you'd like people to use. You can also access the chat box by clicking the chat button at the bottom of your Zoom window. Later in the session, we will open up the conversation with a Q&A session. If you have questions, we invite you to share them in the chat box throughout the session, and you can send your questions at any time, and we'll do our best to raise them. If we have time, we may ask you to raise your hands so that you can ask your question using the audio function. And last, if at any point you experience technical issues, please check your audio settings and your internet connection. If you get lost, please just reconnect to the webinar using the same link. So that is it from me. Now over to Edward Frangillo, Professor and Director of the Global Health Initiatives at the Arnold School of Public Health at the University of South Carolina, and the co-investigator of the Drivers of Food Choice program. Thanks.
Well, thank you, Sylvia. Hello, everybody. So Sylvia has given a very good introduction to the session today. We're holding this session because we know that there's rapid transitions going on in Africa and Asia and other places where people have been living in with high levels of poverty, and that there's big changes in agriculture and markets that have been emerging. And so the UK Foreign, Commonwealth and Development Office and the Bill and Melinda Gates Foundation funded Drivers of Food Choice program so that we could build a base of knowledge about how food choices are being made in these countries. And food safety is an important issue because not just from a biological perspective and chemical perspective about what's in food that could be harmful, but food choices are influenced by people's perspectives about the food that they see. So we have four exciting and crisp presentations today about aspects of this. And so we'll just jump right in and begin with Shilpa Konstantinides giving us an overview, and then followed by three other presentations. So Shilpa?
Thanks, Ed. Let me go ahead and share my screen. Okay. Hello, everybody. I'm pleased to have this opportunity to share with you a synthesis of evidence from the DFC project on understanding the influence of perspectives on food safety on food choice. I'd like to thank the investigators that contributed their evidence and expertise in developing this synthesis, as well as the team from DFC for their efforts in bringing it to fruition. Global commitment to ensuring access to and consumption of sustainable, healthy diets for all is growing, and ensuring food safety is central to achieving these goals. But shifting food systems and food environments in low and middle income countries due to macro level changes like urbanization, globalization, new technologies, climate change, and migration have altered the production, distribution, and consumption of foods in ways that increase the transmission of the risk of foodborne illness. And contamination may occur at one or more points along the now lengthened supply chain between production and preparation of food. The causes of foodborne disease include biological hazards and chemicals that include pesticides and substances used to adulterate certain foods, such as melamine and milk. Foodborne illnesses are a major cause of diarrheal diseases, which can be acute and lead to chronic conditions like micronutrient deficiencies, stunting, and wasting. And consumption of food contaminated with some harmful fungi or chemicals is associated with development of some cancers. The highest burden of disease is in sub-Saharan Africa and South and Southeast Asia. In LMICs, the market structure is complex and comprised of modern retail outlets and traditional food markets, which include informal markets and formal wet markets. But food sources that people access in LMICs remain largely traditional, informal, and diverse. And while these support dietary diversity in the poor, they're also primary contexts for foodborne illness transmission. And consumption of the highest risk foods for foodborne illness, fruits, vegetables, and animal source foods, is increasing. There's also limited government capacity for regulatory oversight in both the formal and informal supply chains, a challenge which is exacerbated by supply chains that have become longer and more complex. So conceptualizations of food safety in the food environment have focused primarily on physical contamination and objective measures of food safety. Consequently, whereas there's been substantial research on supply side drivers of food safety risk and mitigation efforts, there's limited research on individuals' experiences and perspectives regarding food safety and their influence on food choice behaviors and healthiness of diets in LMICs. So the objective of this presentation and the rest of this webinar is to consider the following question: how do perspectives on food safety influence individual food choice? The purpose of the DFC program is to facilitate, synthesize, and disseminate research to provide a deep understanding of the drivers of food choice among the poor in developing countries in South and Southeast Asia and Sub-Saharan Africa. And the program included 15 projects across 10 low and middle income countries. Today, I'll present the learnings from 6 DFC projects with significant findings related to the role of perspectives on food safety and food choice decision-making. These projects were in peri-urban, urban, and rural settings across Tanzania, Kenya, Vietnam, Ghana, India, and Guinea. So we found that there are conditions and characteristics that contribute to both positive and negative perspectives on food safety. Food was considered to be safe if purchased from vendors who had good food and personal hygiene practices or with whom individuals had positive relationships. And it was also considered to be safe if it was prepared at home. But perceptions of a lack of food safety were increased by fears of adulteration by informal and formal vendors and contamination in physical environments with poor sanitation or handling practices. Policies and regulations offered increased guarantees of safety, but were not always trusted nor convenient. And social networks and the media were important sources of both real and false information about food safety. So we see that food choice decisions are not just based on attributes of food. Rather, aspects of the vendors have an influence on individual food choice. And policies and regulations can be used to offer expectations of safety, but can also fail to do so through poor practices that erode trust or by not considering the role of convenience in individuals' choice of food source. And different sources of information like social media or word of mouth can be crucial to disseminating truth, beliefs, and rumors. These conditions and characteristics that drive perspectives on food safety in turn drive food choices, suggesting that understanding the influence of perspectives on food choice may be useful in incentivizing supply chain actors to adopt safer production, processing, and handling practices, where supply-side interventions have so far fallen short. And policies intended to improve food choice must recognize and engage with individuals' knowledge, experiences, preferences, and attitudes around food safety. So the following presentations will present in detail their findings on the influence of food safety perspectives on food choice in 3 different settings. And while you listen, we ask that you think about the implications of these insights on how considering perspectives on food safety can inform current and future policy and program actions that are aimed at improving food choices in LMICs. This is a list of published findings from the DFC team and the DFC subgrantees who have contributed to the analysis that we just presented on food safety and food choice. And just again, as a reminder, the third webinar in this series, which is Changing Values in Food Choice, Implications for Demand Creation at LMICs, will be on March 11th, and we encourage you to register for that. Thank you.
Okay, so now we turn to Michelle and to Amos.
Okay, so Michelle is muted.
Yes. Can you see that okay?
Yes.
Okay, great. Okay, so I'll start. So yes, thank you very much to the organizers for inviting myself and Amos La today to speak about the work we've done in urban Ghana. Amos was actually coordinated the work in Ghana and I coordinated the overall projects. Oops. Sorry, I'm having trouble getting to the next slide. Yeah, there. Okay, so I'm going to talk about the findings from two projects that we undertook. So the one which was funded by the DFC team, and then another project which was a sister project undertaken also in urban Ghana, but also in urban Kenya, and that was funded by the UK GCRF programme. And the work that we're going to talk about is actually part of a real collaborative effort involving 3 teams in the UK from the universities of Sheffield, Loughborough and Liverpool, 2 teams in Ghana, University of Ghana and the University of Health and Allied Sciences, and then the African Population Health Research Centre in Kenya. And then lastly, the CIRAD in France from the UNESCO Chair of World Food Systems. And it really represents an interdisciplinary team that integrates nutrition, public health, and social sciences. So what we aim to do in our project was really 3 things. So first of all, to find out what people were eating. So to assess current food consumption patterns. Secondly, to see what factors were influencing what people eat, particularly within the urban food environments, and particularly what affects their consumption of unhealthy foods and beverages. And by unhealthy, we had defined that in terms of nutrition. And then lastly, we use that information from these first 2 components to identify context-relevant interventions and policies that could work to promote healthier diets within Ghana. So we undertook a range of studies at different scales, from the local through to international levels, involving people in their communities, right up through to looking at international policy levels. And this has involved a kind of mix of qualitative and quantitative studies using primary data collection, as well as using other secondary data that we've integrated within systematic reviews. But what we're going to talk to you today about is the findings from our photo voice study, which is actually the study which yielded most findings and most insights around food safety. We have published quite a lot of work that we, across the different work packages that we undertook, so you're welcome to contact me or to follow on some of these links as well. So our photo voice study was really trying to explain further and to get under people's skin around what the factors are that shape dietary behaviours. And the way that we did that was we used a range of different methods. So we had a qualitative approach using a photo voice or participatory photography method, where we gave cameras to participants and we asked them to take photographs around 5 main themes, which included someone that influenced what they ate, a place where they eat, something that makes healthy eating either difficult or easy for them, and something within their neighborhood that influences what they eat. And I should mention that we were focused on participants living in deprived urban neighborhoods, and that included adolescents and adults. And we had over 96 participants in 2 Ghanaian cities. And these photographs are accompanied with in-depth interviews, which really help participants to tell the stories of food in their lives and what influences their food and dietary behaviours. And we undertook thematic analysis using a socio-ecological model to then look at what kind of environmental levels were influencing dietary behaviours. So I'll now hand over to Amos, who's going to talk about the findings of the project.
Thank you, Michelle, for setting the stage for me to present the findings of our study. For those who may have missed the introductory slide, my name is Amos La. I work for the School of Public Health at the University of Ghana in Accra. And as Michelle indicated, I co-led the Dietary Transitions in Ghanaian Cities project with Michelle, from which this presentation derives. And as Michelle indicated, in this study, we engaged individuals in the communities that we found them. And these individuals indicated in no uncertain terms that food safety was an important issue to them. We have organized here those issues or concerns in 3 themes. The first theme relates to poor food hygiene, and the second, environmental sanitation, and then the third theme, food contamination and adulteration. Let's take a look at the first issue, poor food hygiene. So next slide. So issues relating to poor food hygiene concerned cleanliness of food vendors and poor food preparation method. And so those issues were dear to the hearts of the individuals we engaged. And so these individuals exhibited preferences for vendors who would cover their hair with hair nets, clean their food produce before cooking them, use clean water, clean their stalls, and cover their food. As one of them noted, this vendor covers her food with clean materials to prevent flies from sitting on them. When she is not selling, she tries to always clean the surroundings and then her utensils. Because of that, I like to buy food from her so that I do not have stomach problems. And not having stomach problems here relates to food safety. If you eat contaminated food, you would have diarrhea and other related morbidities. And so they know what they want. What they want is safe food. But sometimes there are challenges. We can move to the next slide, please. So the second issue relating to poor food hygiene, rather related to issues not specific to biological concept of food safety, but those relating to economic or social safety net. And so, for example, these participants, although would prefer to buy food from vendors they believe were vending safe and clean food, there are others who would buy food based on hospitality of the vendor or friendliness, or as they noted, those who have good heart. Others even noted they would prefer to buy food from those who are willing to sell food to them on credit. And so one of them noted, when you don't have enough money, the vendor is ready to give you food on credit, and you can come back and pay at a later date. She's even preferred to give you extra food stuff, and this helps me a lot. So you can see, yes, food safety is an important issue, but there are other important variables to them. Okay, we can move to the next slide now. There were also concerns surrounding home food environment. Of course, in the communities that we work, a lot more people get food from outside, but more of the community members actually get food from within home. So they prepare food from home and then they consume those food. And generally, they perceive those food to be safer than the food they buy from outside. As far as home food environment issues were concerned, those relating to food availability, food safety, and then facilities that are used to prepare were some of the issues raised. We can move to the next slide. A lady that we engaged noted, that when I'm cooking, I wash my hands and I wash the vegetables and get them really hygiene so that when I'm enjoying the food, I enjoy it to the fullest. issues relating to the fact that food has to be safe for you to enjoy. Okay, next slide. And then this takes us to the second issue, environmental sanitation. And those mainly were due to poor drainage systems and waste disposals. And these issues, for years, public health professionals have linked them to frequent outbreaks of infectious diseases, including cholera. And those of you who are familiar with the Ghanaian environment, occasionally we have cholera outbreaks. And so in your shot is a public toilet. And this toilet is sited very close to private premises. As one of the residents noted, this is a toilet and is sited in front of the house. There are times when the stench coming out from the toilet is so strong that we have no option but to run inside our rooms before we can eat our food. So environmental sanitation in the area that we work was seen to be a major problem. We can move to the next slide. And that next slide shows a second photo, a photo of a gutter that runs through a house. And as one of the participants noted, and this gutter is dirty. Whenever I see it, I don't feel like eating at all. Okay, we can move to the next slide. Okay, so the next issue relates to their third concern relating to food adulteration and food contamination. Indeed, such has been an issue in Ghana for years. From those days when Sudan 3, Sudan 4 dyes were declared substance non grata in Ghana because these substances are known to be carcinogenic, yet they were being added to certain food produce like palm oil just to increase their market value. And so they were banned. From those days to recently, when consumers are concerned about food adulteration and contamination by vended food, street vended food. And so as this suya or kebab lover, as we refer to them in Ghana, noted, though we love our meat, this food corner is not in a hygienic position. The meat is sold in the open, close to the gutters, and prone to dust, sandy wind, flying insects, and smoke from moving vehicles. And so he wouldn't buy, and you understand why he wouldn't buy. He cares about safety or food safety. Please, we can move to the next slide. Okay, so from Sudan 3, Sudan 4 dyes to vended food, street vended food that may be contaminated with certain additives. Lately, when people are concerned about hormones and other unknown additives added to street food, including noodles. And so this participant noted, these instant noodles that we buy almost every evening, they add all sorts of artificial spices to it. The sausages, all of such are not good for our health. But there are times when we just have no choice but to eat them. And so as I noted earlier, consumers know what they want. What they want is safe food, but there are times when they have no choice and then just go with whatever they can afford. On that note of having no choice, I think we can talk now about the financial accessibility issues. And so, yes, they know what they want. What they want is safe food, but financial access is a major barrier to accessing nutritionally safe and healthy food. And so one of them noted, so having no money makes eating healthy really, really difficult for me. If you have, for example, no money and all that you have is 1 cedi, what can 1 cedi buy? Just for the international audience, 1 cedi in Ghana is equivalent to 20 US cents. And you only have 20 US cents to use to buy dinner. Just, you can imagine what it can buy. And someone with just 1 cedi may be concerned about food safety, but whatever the 1 cedi can buy is what it will buy. And so financial issues were also raised to be important. I think on that note, those were some of the perceptions shared by our study participants. Those perceptions relate to food safety, and they are important for both practitioners and policymakers. Of course, there are quite a number of unanswered questions. We are interested in exploring those questions. Michelle, we can move to the next slide. And to do that, we are currently conducting a systematic review of evidence focusing on lower middle income countries. Through these and other studies that we are embarking on, we hope to be able to explore the linkages between food safety concerns and unhealthy diets that lead to multiple forms of malnutrition. There are even issues relating to whether or not people fry food just because they want to keep it safe, and we want to explore that in our next studies. We are also interested in examining whether processed food or people perceive processed food and beverages to be safer because they are processed compared to perishables. And so these are other things that Michelle and myself and other team members are exploring currently. So thank you very much.
Okay, thanks both of you, to Michelle and Amos for their work in Ghana. So our next presentation is from Jessica Ranieri, who couldn't be with us today, but kindly recorded her presentation in advance. And so we'll hear from her and her colleagues.
Hi everyone, my name is Jessica Ranieri, and today, or tonight, depending on where you are in the world, I'll be presenting some insights from work our team did in Hanoi that looks at how food safety concerns shape diets within the context of the urban poor in Hanoi. Since the 90s, Vietnam has experienced high levels of economic growth that has brought with it significant progress in decreasing its rates of undernutrition. However, overweight, obesity, and the prevalence of NCDs, that's non-communicable diseases, is increasing, particularly in the urban areas, which is putting immense pressure on public health systems. Vietnam is experiencing the nutrition transition, essentially, and it's still battling both over and under nutrition challenges. 1 in 4 women are anemic, nearly a quarter of children under 5 are stunted, which is higher than the regional average. 6% of children under 5 are wasted, yet at the same time, childhood obesity is rapidly increasing, with recent data suggesting that up to 42% of children in Vietnam's urban areas are overweight or obese, and 35% in rural ones. Adult women and men are both experiencing higher rates of obesity, women more so than men, and we know that diets are rapidly changing. People are consuming less rice and fruit, and more meat, fat, and dairy. Essentially, they're experiencing the westernization of their diets, the introduction of fast foods and ultra-processed foods, foods that have increasingly a body of evidence that is showing that their consumption is related to increasing prevalence of overweight, obesity, and NCDs. Over the past 30 years, food safety has become one of the top concerns of Vietnamese consumers and the Vietnamese government. The cost of foodborne disease was estimated of up to $450 million US in 2003, with 128 million reported cases of food-related illnesses. In the past years, food safety and food poisoning have sparked widespread media coverage and triggered the first ever public outcry, highlighting the gravity of Vietnam's food safety crisis. The photos here are taken from Vietnamese news and media outlets. The first shows a food safety inspector inside a supermarket, and the second an infographic from the news communicating the extent of food safety concerns. This approach is creating food safety paranoia and panic. People almost on a daily basis are hearing about one food safety crisis or concern or another. Now, pesticide and other agrochemical contamination of fresh fruit, vegetables, and pork are often at the forefront of consumer fear around food safety. However, there is actually very little publicly available contamination data to support this, and what data does exist suggests that the primary cause of foodborne illnesses rather comes from bacterial contamination instead. But despite this, what is evident is that Vietnamese consumers lack confidence in the safety of the food that they are consuming, and at the same time, government has a plan and is actively trying to improve consumer trust in the food that they are buying. What we know is that these concerns around food safety have essentially seen the food environment to change in Hanoi. Overall, Vietnamese consumers are creating a demand for safe foods. And as a result, in Hanoi, there has been a surge of safe food restaurants, safe food and safe vegetable marketing, and even specific safe vegetable stores. People often speak about safe foods as a measure of quality, and it's used almost on a daily basis. Now, the government was leading the combat against foodborne illness through a modernisation policy, which explicitly aims to reduce food safety incidents through a combination of legislation and retail modernisation. And this retail modernisation specifically is aiming to reduce the amount of traditional retail outlets such as wet markets and street vending in favour for modern outlets such as supermarkets. Now, in 2006, the government also started an incentive mechanisms for supermarkets that required all modern retail outlets to possess a certificate issued by the government that verifies that the vegetables that have been produced that are for sale are in accordance with national regulations on safe vegetable production. So this retail modernisation policy is part of Vietnam's transition into what the government is promoting as a modern society, where their aim is that food provision is primarily through supermarkets and convenience stores at the cost of a reduction on traditional retail outlets. So in this case, supermarkets and modern convenience stores are basically marketed as the gold standard for safe food, and the policy has been largely successful in achieving a reduction in traditional wet markets and an increase in modern retail outlets. Now, the problem is, from previous research, we know that while supermarket shopping can improve diet quality and food safety in some contexts, other research in the region suggests that this can influence consumers towards favouring more imported and packaged foods. Now, this really is a concern in Vietnam, given that they are already battling a nutrition transition and increasing rates of NCDs. So what we saw happening in Vietnam is that food safety concerns from both the consumers and the governments have seen a transition of Hanoi's urban food environment. We saw a reduction in traditional wet markets and an increase in modern retail outlets such as supermarkets. So we focused our research on the urban poor in Hanoi, given that they are at an increased vulnerability to food and nutrition insecurity, especially within the rapidly transforming city. And previous research shows that this demographic specifically shop within walking distance from home to accommodate their busy lifestyles and their preference for daily shopping practices, which is based on the fact that they often are only earning income on a day-to-day basis. So we assume that changes in their immediate food environment would likely have significant impacts on their shopping and dietary practices. But we also decided to focus on the urban poor because there is very little data related to food choice and nutrition for this demographic. So we wanted to know if these structural changes to the availability of retail outlets and the shift away from traditional to modern retail outlets would affect how the urban poor shopped and ate. We also wanted some insights into how these women's perceptions and practices around food safety might be at play. What we expected was that we would see women who didn't have access to wet markets would be funneled into supermarkets, and that supermarket shopping would essentially be associated with a worsening diet quality. Now, in regards to the methodology, my co-PI on this project, Dr. Sigrid, presented during the last DFC webinar in depth on this, so I won't go into too much detail here, but we did take a mixed methods approach to our research using a combination of qualitative and quantitative research methods that included a retail outlet census, a repeat quantitative 24-hour diet recall, a nutrition knowledge, attitudes and practice survey, as well as a food safety and food acquisition survey. We also did in-depth multi-generational household interviews and observational shopping trips. So we had a sample of about 400 women, and we separated them into 4 strata based on their walking distance to different retail outlets, as described there on the right. Generally, we didn't we saw that diet quality was minimal across the board, and we didn't really see any significant difference between the main diet quality indicators or across the different stratum. Now, this essentially tells us that physical distance to food outlets didn't significantly change diet quality. Overall, diet diversity was minimal, with about 75% reaching minimum diet diversity. But what's important to note is that they had an average diet diversity score of just 5.3, meaning that they are highly vulnerable to shifting to below 5, which would drastically decrease the percent of women who reached minimum dietary diversity. We also ran some regressions and found that higher nutrition knowledge was associated with a higher dietary diversity score and dietary species richness, as well as micronutrient adequacy overall, more likely to reach minimum dietary diversity as well. It was also associated with lower starchy food and sodium consumption and higher legume, dairy, and vitamin A rich fruit and vegetable consumption. Regarding micronutrient intakes, we similarly did not see a difference across the different strata, but generally we saw that there was a problem with calcium, iron, and zinc, which in a way was not a surprise given that it is well documented for the Vietnamese population through their general nutrition surveys. We saw no difference in ultra-processed food consumption across the strata, and we ran regression models for this and found that as the percent of foods sourced from supermarkets in the diet increased, the consumption of ultra-processed foods also increased. Inversely, as foods sourced from outside of Hanoi, for example, from a family farm, increased their presence in the diet, we inversely saw the consumption of ultra-processed foods decrease. So generally, diet quality was minimal across the board, and we didn't really see any significant difference between the main diet quality indicators and different strata. So physical distance to the outlets didn't really change diet quality. Or at least it wasn't enough to change the diet quality for the urban poor. So we wanted to look a little closer at where women were shopping and what they were buying to get some better insights into what was going on. First, we had a look at the dietary intake data for which we had asked for each ingredient and food that was reported as consumed, where it was purchased. And from this, we were able to see that overall, urban poor did not utilize the modern retail outlets in a significant way. Their diets were mainly made up of foods purchased from traditional food outlets. And in fact, their diets are still relatively traditional in terms of their composition, as well as from where they purchase foods. There was no difference in the ingredients or foods sourced from supermarkets across the strata, and these foods overall only contributed 8% of total foods consumed. What's interesting to note is that in strata where no wet markets were available, there was a small but significant increase in the number of women who sourced foods directly from outside of Hanoi, i.e. from their own hometowns or from a farm to fork initiative. Now, we also cross-checked the data with the food safety and shopping preferences survey that we did, and we see similar results. Only one woman reported that most of her shopping was done at supermarkets, and most women shopped in traditional and food retail outlets as their primary source of shopping. Across the board, shopping from informal street markets was reported as the most common place women purchase most of their food. When a wet market was available, more women chose to shop at wet markets instead of an informal street market. And when no wet market was available, most women preferred to do their main shopping at informal street markets. What both of these last two slides tell us is that consumers are increasingly turning to street vending in the absence of traditional wet markets, and that in some cases, even when both supermarkets and wet markets are available, street markets are still contributing to a quarter of foods consumed in the diet. This tells us that the urban poor are prioritising their traditional and preferred dietary practices of accessing fresh foods that they can purchase daily, rather than being shifted into supermarkets where this is more difficult for them in their perception. However, of course, the trade-off here, and this is what's to be highlighted, that there is a potential increase in food safety risk by shopping at informal street markets because there are even fewer food safety controls and practices in place compared to a wet market. So then we had a look about how women perceived food safety. And we see that diets are not really changing based on accessibility to retail outlets, and that shopping practices are not really changing either. Consumers are not using supermarkets, which the government promotes as the gold standard for food safety, even when they are the most readily available outlet. So we thought it would be useful to take a bit of a dive into how the urban poor think and perceive their risk to food safety. What we saw was that nearly 3/4 of women were frequently and severely concerned about their food safety. This confirms that the concern is real and likely contributing to their daily stress. Interestingly, despite this, food safety was not highest on consumers' list of concerns when making decisions about which foods to produce. Their higher priorities were ease of preparation, price, nutrition, and health. Nearly all consumers believe that wet markets provide safe food nearly all consumers believe that wet markets provide safe food, compared to only 68% who believe that supermarkets provide a safe food. Our research showed that this is largely driven by two factors. One, that they believe wet markets offer fresher food than supermarkets, as well as a mistrust in the supermarket safe food marketing due to several outbreaks of foodborne illnesses related to supermarkets, as well as insights from workers on the supermarkets on what they had observed as being bad food safe practices. Overall, 85% of households reported that the price of formal food safety regulated food items was too high, even when sold through specialised retail outlets. We identified that a large reason for food safety not being a top priority when purchasing foods, despite people being concerned about it, was because women often applied their own mechanisms for food safety assurances. We can see that nearly all women believe that the way in which they clean their vegetables made them safe for consumption. Increasingly, we see a trend of buying direct from farms, or fresh is best narrative. So when they know where the food is being produced from, they believe that they can ascertain if it's safe or not. There is also a lot of trust built into the vendor-buyer relationship, a relationship unique to traditional market vending and often absent from supermarkets. Regardless of the mechanism in place, we see that most consumers believe that they are effective in protecting themselves against food safety risks. And as such, it makes sense as to why they would continue with their preferred way of shopping in wet and street markets. So let's go back to our hypothesis. Do food safety concerns shape diets in Vietnam? Well, apparently for the urban poor of Hanoi, not so much. We see other behavioural and preference factors at play. Our research told us that changing physical access to traditional wet markets wasn't enough to change diet quality for the urban poor. The urban poor prefer to still use traditional shopping outlets instead of supermarkets. When wet markets aren't available, their preference is to go to informal street markets rather than supermarkets. And this presents new food safety concerns, as informal street markets have higher food safety risks than formal wet markets. So we see that overall, the policy for retail modernisation overall hasn't really significantly changed diet quality for the urban poor. It's shifted consumers into a more unsafe shopping practice. Even though nearly all consumers are worried about food safety was not highest on the list of concerns when making decisions about which foods to purchase. Their higher priorities were ease of preparation, price, and nutrition and health. Those that did shop at modern retail outlets consumed higher amounts of ultra-processed foods, and those with better nutrition knowledge, attitudes, and practices did have some better dietary outcomes. As the government further rolls out the policy and wet market availability further reduces and street vending is eventually clamped down on even further, it's inevitable that even poor consumers will be funneled into supermarkets. Our research suggests that this is associated with the risk of increased consumption of ultra-processed food, but that better nutrition, knowledge, attitudes, and practices could help mitigate this. Governments are recommended to combine consumer awareness and nutrition education campaigns, as well as explore innovative supermarket design to encourage consumers to continue to make healthier food choices. This research shows that the government's policy intended to combat food safety concerns of consumers in Hanoi is not currently having the anticipated impact on the urban poor. Likely, the policy was not designed with the urban poor in mind. More inclusive policy design and implementation that consults and includes all demographics of the city are recommended for future food safety policy. So thank you for your time and apologies for not being able to be there live. I currently live in Sydney, Australia and have a 3-month-old baby. So logistically, it made it impossible for me to join live today. But if you have any comments or questions, please feel free to drop me a line. Thank you.
Okay, thank you, Jessica. So our last presentation is by Crystal Patel and Jomana Lena. So why don't you go ahead?
Can you confirm that you're seeing the correct screen?
Yes.
Okay, thank you. Hi, I'm Crystal Patel, and my portion of the talk, first 7 minutes, focuses on food safety perspectives of adults affected by HIV and living in peri-urban Tanzania. Dr. Lena will then take over and provide insights on the context of food safety and policy change in Tanzania. The webinar is focused on food safety because it's a growing global health concern. Foodborne illnesses have a large impact on death and disability, and in fact, sub-Saharan Africa carries the largest per capita burden, with 91 million acute cases and about 137,000 deaths each year. Given that 70% of persons living with HIV live in this region, and that people with HIV are more susceptible to infection, food safety and exposures are an important consideration for overall health. The DECIDE study used longitudinal surveys, geospatial mapping, and qualitative methods to characterize the food environment, identify drivers of food choice, and evaluate dietary adequacy among families affected by HIV and living in one peri-urban community outside of Dar es Salaam, Tanzania. Before moving on, let me acknowledge our team. Each has contributed to the design, data collection, and/or analysis for this DECIDE study. Most of the data I'm presenting today come from qualitative interviews. These interviews were conducted in Swahili, transcribed and translated for use in our analyses. About 60% of the participants discussed some aspect of food safety with us. However, about 40% did not think food safety was an issue. For example, one woman who was 39 years old and a caregiver of a person with HIV said, "I never had doubts. Truly, I'm not worried. I see everything as safe." When participants talked about food safety, we found that comments were linked to the media, an experience, or observations, or some combination of all of these. Media and rumors were mentioned as sources for food safety information. Pictured here is an article that circulated focusing on what was called plastic rice. This rumor posited that there was resin and starch added to the rice that was for sale at markets. And although the rumor was never substantiated, 2 years later, several of our participants mentioned worrying about this. This picture is from a 2015 newspaper article discussing how juice vendors may not institute proper sanitation practices. From our study, several people talked about juices as a problem food. One woman said, One woman said, "I worry about food preparation. I can't drink the juice that is sold in the streets because I know to a greater extent that most people who make juice do not make it in a clean environment." And this is corroborated by a study that did look at unregulated fruit juice vendors in Dar es Salaam and showed that about 80% of samples had E. coli detectable in them. And this might explain why locally prepared juices were a concern for some folks. Not all media, however, was negative. One male participant listened to a radio program on food safety in restaurants, and he described what he learned about food handling and the importance of hand washing. He connected the lack of hand washing to bacteria exposure. Another specific food item that participants were concerned about was what's called improved chickens. And when they had concerns, these concerns were about the way the chickens were raised, their rapid growth rates, the use of antibiotics, and the conditions of the coops. When people talked about vegetables, they were very often concerned about chemicals or pesticides that were used to grow them. And they talked about the residues left on the leafy greens and the tubers and these were especially worrisome. Others described worrying about where the plants were growing and exposures to raw sewage and fecal material, indicating uncertainty about growing location. One woman said, "You cannot tell whether these vegetables are grown in sewage channels or whether they are grown in clean water." When talking about strategies used to avoid foodborne illnesses, responses fell into two categories: what to do at home and ways to assess vendors. One woman talked about avoiding eating outside of the home. And she said, "Recently, my husband was sick. He had bacteria which were caused by the food he ate at a place near his work." Another participant mentioned growing their own food. She said, "I worry about chemicals in vegetables. That's why I try to plant my own vegetables." Others talked about the importance of washing all fruits and vegetables to remove residues. Another important driver of food choice was the perception of food safety and vendor properties. Familiarity or knowing the vendors led to customer loyalty. A network and a connection help participants make decisions about where and what to buy and who to buy it from. One woman said, "I buy vegetables from 2 women only. I don't just buy vegetables from any vendor, no." Professional looking vendors, like this woman in the middle wearing a clean white apron and carrying pre-cut fruit snacks wrapped in plastic, is being strategic. She's sending a message of good food preparation hygiene. For meat choices, participants tended to also be familiar and particular about vendor choice. The use of modern machines and being able to see the meat and its processing was important. As exemplified by one participant, he said, "I normally buy meat from a specific butcher. Its environment is made with glass, meaning the windows, and they cut the meat with a machine." Here you see some data from our survey, and it's just looking at the different types of meats purchased, which is what's on the y-axis, and the type of vendor across the bottom, which is formal in the purple and semi-formal and informal. And what we learned that with the exception of beef, more than half of these food purchases took place outside of the formal sector. These indicate that the informal and semi-formal food vendors are a significant source of meat purchases. And when we looked at this for other foods like fruits and vegetables, this pattern held, and it also held across food insecurity levels. So this study does have limitations. First, we did not reach saturation on the topic of food safety, but this qualitative work highlighted the need for some additional things. First, the role of the media and the sharing of accurate and inaccurate information. Second, a need for more gendered lens on understanding of food safety. And last, better tools to capture perceptions of food safety at multiple levels and from multiple perspectives. Given the major role that semi-formal and informal vendors play in the food environment and as drivers of food choice, how would we regulate these sectors without decimating their livelihoods? What do these patterns mean for regulation and policy? Thanks for listening to a very brief presentation of our data, and now I'm going to turn it over to Dr. Lena, who will provide context on the food safety in Tanzania and the institutions involved at the national level.
So thank you so much. Sorry, I forgot to turn on my mic. It was off. I'm quite happy to see that the domains and worries that have been shown in Ghana are more or less with what Crystal has just provided when it comes to Tanzania. And we thought it was a good idea to provide a little bit of background knowledge on the frameworks that exist that try to curb or mitigate issues in relation to food safety in Tanzania. Next. So food safety is something that is of concern, and the government and policymakers do acknowledge it as one of the important areas that need to have policy and regulations. In Tanzania, there are various entities that look after and various policies and regulations that look at issues in relation to food safety, such as food production and consumption regulations, issues related to food trade, particularly what is being imported, as well as the safety of that which is being exported. There is legislation and guidelines on code for practice and standards, as well as food control and surveillance. So given the existence of this framework, it means that the government and policymakers do acknowledge that there is a need to protect the public from unsafe foods. Next. So I'm going to share with you 2 slides that show how Tanzania has tried to mitigate issues in relation to food. In 1978, the first National Food Control Commission was established. And this was an institution that was mainly responsible for regulating food import, manufacture, labels, identification, when do we sell, when do we not sell, as well as offering a minimum standard for the quality of foods that are being sold in the country. The commission was also responsible to either test or facilitate the testing of food to ensure that all foods in the country are relatively safe. They also had a mandate to offer legal measures for those that did not comply with these rules and regulations. Now, 1978 is quite a long time. So in 2003, they improved these regulations by enacting or establishing a new entity. Next. We emulated the US government with the Drug and Food Authority. So we also established the Tanzania Food and Drugs Cosmetics Act, which more or less inherited majority of the responsibility from the National Commission to do, in addition to medical devices and drugs, also to look at the safety of food. There was a huge laboratory that also tested all the foods, ensured that what was being imported and exported met the standards that were developed in the country, but also tried to comply with other international standards. Next. Now, as you can see, a lot of regulations were then made post-establishment of the Tanzania Food and Drug Act in 2003. And as you see, some of these regulations do also deal with issues in relation to hygiene or in relation to food safety. For example, you have the Food and Hygiene Regulations of 2006, which provides information on how should food establishments be designed, should be developed, what should be there, how should you sell the food. And this is particularly for both formal and informal sectors. We had a food labeling regulation. We even have the transport of meat regulation to ensure that meat is being transported from where it is being butchered all the way up to where it is being sold. Principally because this is a tropical area, and hence if food is not transported in the proper manner, you might face contamination as well as unhygienic conditions. Next. We also have a lot of guidelines, such as there is a role for conducting risk-based inspection in food premises. There is a guideline on how to investigate and control for foodborne disease, as well as a program on monitoring of food contaminants. Now, all these more or less are issues that resonate with the findings that have been presented by Crystal and Ghana. So the biggest question becomes, what opportunities exist further to support or to enhance the roles and functions of these frameworks? What are the challenges that are being faced? And do the population know the existence of these frameworks and how they can better use them in order to ensure that food safety is on the front line, it's being discussed, and populations know about it? Next. So thank you very much. My key role here was, when you digest and when you interpret the findings, Also look at the frameworks that do exist in Tanzania and maybe also exist in other sub-Saharan African countries or low middle income countries, and how they fit into the wider picture of food safety and how our populations interpret it and use it as a means to decide which food they should put on the table and which ones they should not. Thank you very much.
Wonderful, thank you very much. So we have succeeded in matching our goal for time. We had 4 fantastic presentations, and now we can open it up for discussion. So we have some comments, questions that have been put into the chat box. We can start there. If you have others, please put them in the chat box, or you can raise your hand and we can call on you. There was a question, maybe we can start with a question that was directed to Jessica about what respondents meant by health, because it sounds like foodborne illness was not included in health, and how was that interpreted? And Jessica's not here to answer that. If anyone else can answer that, please speak up. I guess I would comment that we did some work led by Melissa Jensen and Jeff Lewa in an indigenous community in Guatemala, and it was interesting there that they thought about food as very much integral to health, but in other situations, people think about food as contributing to health. And so I think the general question that was raised is a good one to make sure we try to understand how people conceptualize that. Any other comments from anyone about insight about the role of food and food safety and health?
Ed?
Oh, Sigrid, you're here.
Yeah, I'm here. So if people have questions related to the food safety research in Vietnam, I'm happy to respond to those.
Okay, so do you want to comment on that then?
Yeah, can you refer to the question, because I didn't hear it very clearly. What was the precise question?
The question was, what did respondents mean by health? It sounds like foodborne illness was not included in health. How did you interpret this?
Yeah, no, actually this relates to previous research. So, also in the previous research, we asked people if they or their family members had experienced health problems related to food. And of course, you never know the causal relation between food intake and falling ill, but at least it was a perception of being ill due to food consumption. And those aspects we had included in our research as well. So, and also in relation to if people would be willing to shop somewhere else or to pay a little bit more when it comes to food safety issues. And there we saw a positive correlation indeed. When people had experienced health problems, they would consider buying, or actually not only consider, they would really buy more officially labeled health foods. But in general, health was more kind of a generic idea of how people perceived their own health. So we didn't measure health, neither in relation to food safety nor to more generic ideas. And then also in relation to food safety, what we see that there are different ways in which people see food safety in relation to their health. And one is falling ill directly, having a stomach ache, for instance. But also some people were worried on long-term consequences, such as developing cancer, and they would relate it that nowadays we see more cancer, and they would be not nuancing that because of maybe different diagnostics in relation to cancer, but they would automatically say that's because of the food safety situation in our country. So, but it is all related to perception.
Okay, great, thank you. And by the way, that question was contributed by Isabetta Lambertini. So the next question, Sigrid, also maybe you can handle, from Yves Kameli, asking if you could explain how the 4 strata about walking distance were defined. In other words, what were the distances that were used to differentiate?
We used walking distance with a 300 meters parameter, and it was based on both previous research which we conducted in Vietnam, where we did diary research to assess where urban poor would shop for their food. So it was all within walking distance, within a 300 parameter, and also international research that makes distinctions, and that's also in our publications further defined. That supermarkets at a larger distance or outlets within walking distance, and there the parameter was set on 200 meters. When we included respondents, of course, we couldn't include it from each household perspective, the distance to a shop. So what we did, we made a kind of circle parameters around food retail outlets and then included consumers within that parameter. And then later we redistributed the participants in relation to distance to nearest food retail outlet. And that was all based on this 300 parameter. And then also we did some modulations with different distances, but that didn't really shift in where people would shop, etc. So this appeared to be correct.
Okay, great, thank you. Then we have a question by Ursulan Truvasa for Crystal. And the question is, have the concerns about juice preparation, pesticides and vegetables, etc., led to changes in consumption? You mentioned that some behaviors, such as growing own food, washing food, have been adopted, but have you found changes in actual diets?
Ramya should be on, and I'm not sure that we've done the linkages because our interviews, as you saw, were only with 40 individuals and they were not the same individuals that were in our survey. So if you're on, Ramya, maybe you can link this to the quantitative work.
Yeah, sure. Thank you. Hi, this is Ramya Ambikapati from the DECIDE study. Thank you for that question. So this is a qualitative work, and we do have quantitative work on diets, but it's hard to make that. The food choice was the one determining factor on changing diets. We do have about 30% who mentioned they grow their own food in a sample size of 300 participants in urban Dar es Salaam, but it's not, for me, I think, and it's still a question in the larger, the urban home gardens, is that are people consistently consuming from their own home gardens? It seems like the frequency of consumption varies quite a bit, and it's very varied. So it's hard to make that quantification.
Okay, great, thank you. And then a question from Shiva Bandari for Jumana. The question is, how are the policies and guidelines being translated into actions? Could you share your experiences about how the public responds to these policies and guidelines?
Thank you so much, Shiva, for an excellent question. So, for example, when we discuss about surveillance, for each district, the way Tanzania is administratively divided is that from the national level, you have regions and then you have districts. So in each district, there is an environmental health officer who is responsible for doing random ad hoc surveillances to monitor the hygiene of various areas. And there's a tool. They also can take food samples and submit them to the lab for testing. But as you can imagine, it's a daunting task, given that most of these establishments are informal. They are sometimes not opened 24 hours a day. So they can only really test out those that are more or less permanent and formal establishment. But the informal establishment is not so easy. And so that's where the biggest challenge comes. The framework is there, but it's not really efficient or effective in order to ensure that each and every site or establishment has an opportunity of being tested. There also is a challenge when it comes to how does the public accept this. I think we also are experiencing the same phenomena that, do you prioritize food safety or do you prioritize the cost of the food and availability on the food on the table? So that's also a challenge where people really have to juggle between the two. And depending on your socioeconomic status and where you live, one or either will take up the most priority.
Oh, thank you. If I could just ask a follow-up question, Jumana, that, I mean, the rollout of regulations and trying to translate the policy into action means that it has to be at different levels along the supply chains for food capabilities and capacity for people to understand and put into practice what the regulations are calling for them to do. And I was just curious if there are specific efforts happening in the country to increase those capacities and capabilities.
There are a number of efforts that are being done, various implementing partners, the government itself, a number of institutions that are working towards the same goal. But you have to remember that Tanzania is a population that is 60 to 70%, I would call illiterate, in a way that their level of education is limited. So even the way they translate and interpret the various knowledges that are being pushed back by the government limits. But more and more decentralization is happening. And all these decisions in relation to food safety, although they are made at the national level, the organ that is responsible for implementation is the district level. And so I think there is devolving of power, devolving of more activities at the local level, but there's a lot that needs to be done in order to ensure that these two competing interests somehow speak together, and food safety is still at the forefront of the discussion.
Okay, thank you. So we have another question by Dr. Sablework. There are countries who started setting policies, but they've not been implemented well. And in most developing countries, the focus is more on food security and not food safety. And so how can we improve this? I guess any of the speakers could comment on that.
Hello, Amos here. Can I?
Yes, Amos.
Okay, thank you. Yeah, it's an important question. Given that in settings like ours, Africa, and of course Ghana, governments are having to deal with multiple burdens of malnutrition. And so over years, having been overburdened with undernutrition, a lot of the focus, a lot of the interventions have been focused on ridding countries or the continent of undernutrition. And now we have other forms of malnutrition, including the overnutrition. And yes, it's always been a challenge having to strike a balance between addressing a problem that we have tried to address for years that we haven't been successful, and then attempting to address new other problems. If you take, for example, in Ghana, just as in Tanzania and other places, I think that there are no shortage of government policies, regulations, or even laws to deal with food safety issues. And so in 1992, the government, through PNDC law 305B, gave life to what we call Food and Drugs Authority, just as in the USA and then Tanzania. So the Food and Drugs Authority, through the Food and Drugs law that I'm referring to, gave birth to Food and Drugs Authority in Ghana. The authority has been mandated by a 2012 law, Public Health Act 851. And so the authority is mandated to ensure food safety issues are addressed currently. Just as other countries are having challenges, we also have challenges here currently in Ghana. If you take, for example, the nature of vending practices, the widespread informality, and for example, the itinerant nature of the business. So they are here today, tomorrow they are not there, and they are not registered. So it's just very, very difficult to manage. And so in addition to the Food and Drugs Authority, there are other stakeholders that they are working with. So there are other acts like the Tourism Act, the Local Government Act of 1993. So all the stakeholders are contributing to addressing the problem, but resources has been a very big challenge, and that is preventing those stakeholders from realizing those goals. So yes, so one thing is trying to strike a balance between whether or not it is the age-old problem of undernutrition that we have to address, or those new issues relating to other forms of malnutrition. There are policies, but resources is the main challenge.
Okay, great.
May I add to that?
Yes, go ahead.
Because I think this is completely spot on. But what you see is then that policymakers, that's what we see at least in the case of Vietnam in our research, but also beyond that, are then relying on, for instance, international corporations that have like kind of food safety standards. So they try to rely on these corporations to also solve part of the puzzle as part of the problem. And that is, of course, a very vulnerable position to be in. So and that's when you see that these multinational corporations that are economy driven also tend to focus on higher income areas. So, and they're not serving urban poor. So that's what you see in these developments as well, in policymakers struggling to deal also with food safety.
So related to that, Sigrid, I wanted to ask about the work that you and your team has done shows that even a well-meaning policy, which makes certain assumptions along the lines you were discussing, can end up in a situation where it may not change the ultimate outcomes, like in this case, diet quality, and at the same time may actually make the situation worse rather than better. And so I guess my question is, can you comment on your thoughts about how this could have been prevented or how it can be mitigated or changed now?
Yeah, I think first and foremost, it's important that no policy does everything. So I think, and also Jessica mentioned that in her presentation, the policy were not designed with the urban poor in mind. And I think it is very important that the voices of these urban poor are heard of, especially with the urbanization of poverty going on. And that is something that is not limited to Vietnam, neither Asia. That's what we see actually all over the globe, and especially in the global south. So what we have discussed with policymakers in this respect is, first of all, to engage with different groups of citizens. They have a responsibility for every citizen and not just for the middle income. How difficult their task may be, also therein acknowledge that your responsibility is not 100% securing everything for everyone, and accept also that citizens can co-contribute to the solution. So, and this idea of responsibility is something that we see particularly very strong in developing economies. Whereas, for instance, a very great example of this is certification, food safety certification. In the West, we are used, that is our third-party certification, that they come in to check. But what we see in many developing economies is that the government that gives out the certification is also the controlling entity. And so they keep the full responsibility all on their own desk and their own plate. And sharing this is important, as well as engaging with different groups within the population is important. And this is opening up also policymakers in time of vulnerable perspective as well in relation to their policy making. And I think that's really crucial and important.
Thank you. Michelle Holsworth asked two questions. I'll ask them one at a time. Sigrid, Sigrid and others, is this transition towards markets and formal convenience stores that's been well described by your team in Vietnam, is this inevitable elsewhere? Is this inevitable in sub-Saharan Africa? Are the same kinds of forces likely to be in play elsewhere?
Yeah, I don't know if someone from Africa wants to report, but I've been involved in projects also in Africa where supermarket retailing is pushed because of this logic that I said, that also policymakers want to share their responsibility with these larger corporations. So whether it's inevitable, yeah, that's a difficult question, but that it's an ongoing trend, I would say yes. And there I think it is important that this supermarketization, we should also use now, as we learn also from the Western diets, how it can contribute to unhealthy patterns. So we often question ourselves, what is more unhealthy, eating a lot of sugar or eating vegetables that are contaminated with pesticide residues? So what is more unhealthy? This question is coming to the forefront, and I think this should be taken on. So whether it's inevitable, I don't know if that's the most appropriate question to ask. It is, of course, but also how can we, if it's going, if that trend is ongoing, then how can we use it for the better? And I think that's to me is a personal, very important question.
Anyone else want to comment on that question?
Observationally, it seems that going to supermarkets is not the place where you go for fresh foods. People aren't happy with that large market in the same way that we saw elsewhere, that the fresh foods just aren't that good. But let me defer to my Tanzanian colleagues on that, on the use more generally. But another pattern that I've observed is that depends on the person's work. So people who have to come into the city will go to supermarkets because there's lots of pre-made foods there that can be bought for a quick lunch, and like hot pre-made foods, like a like a deli style. But people don't know what's in those foods exactly and how they've been prepared, but they're quick and convenient for when you're eating in the city and have to go back home after. So I think, let me turn it over to Dr. Lena to see if there's more comments on Tanzania and grocery stores.
Yeah, so we also have seen an increase in the number of supermarkets, but they're not really international conglomerates. So like, for example, the South African mega supermarkets have opened up shop in Tanzania, but within a very short time, they've closed shop. So we haven't really seen an influence of international businesses. Interestingly so, even the fast food industry hasn't really mushroomed that much in Tanzania. But we are seeing an increase of more formal establishments to sell fresh fruits, to sell other consumables. I think the biggest deterrent now becomes the cost. They're more expensive than the majority of the dwellers can procure. So at the end of the day, people still go back to the open markets and street vendors. So I would say price is the biggest deterrent over and above other factors that may be at play.
Okay, I must say I'm unable to use the hand raising button. So can I just comment briefly?
Yes, yes.
Okay, yes, I just wanted to agree with the questionnaire, Michelle, on the inevitability of the supermarketization of the African subcontinent. In that the growth of supermarkets as we see it is not a natural growth. There's a force behind them, and it's a force to reckon with. And so beyond what is being presented as their benefit from the point of those who are pushing supermarket, even our governments are buying into that, in that they seem to have positive externality. Government successes sometimes are measured by the number of supermarkets that spring up or have sprung up when you were in power. And so some of these things there's support from government, and once they have support from government, in a few years we are going to wake up and have supermarkets all over. Regarding prices, there's going to come a time when private entities sometimes have a way of sacrificing price for volume, and with time, those things that we see today to be very expensive, you never know, the prices are going to reduce, and you're going to get more people patronizing, and of course they will benefit from that. Thank you.
Okay, thank you. So Michelle asked a related question that I think fits into this line of thinking about the implications for livelihoods in Vietnam of this change, and I think maybe Sigrid, you could comment on that from a Vietnam perspective, but maybe also others could comment on that. That the implications of this are that moving away from sort of traditional livelihoods and, in a sense, industrializing the food system in the country in ways that haven't been there before. So any thoughts, Sigrid?
Yeah, I think this is a very important point that's often overlooked. So I think this is a very good question. And also the urban poor relate to it as consumers, because it relates also to the vendors. So if the vendors has to disappear and they used to live in those areas, they lose their livelihoods. And there would also smallholder farmers have no access to larger supply chains, they lose their livelihoods. So it is a big issue. So it's not only the consumers that might be have limited access to certain foods, but it's in a much broader perspective, also in relation to the services vendors provide in terms of cutting and cleaning, and this whole informal business, and actually this informal economy, or it's also in terms of diversified economies, yeah, what does it mean if we formalize everything in a single direction? And that's also maybe said that you need a bit of diversity also in this retail landscape in urban areas to assure livelihoods far beyond the consumers and their diets at stake. So I think this is a really important consideration.
Anyone else want to comment on that? Okay. I wanted to come back to something, Crystal, that you said at the end of your presentation about the need to think about it, the issues that you discussed from a gender perspective. And I wonder if you could just elaborate a little bit more on what you think would be important to examine, to think about in that regard.
Yep. So from our qualitative reviews, like I said, we didn't reach saturation because for food safety, it wasn't what we were prioritizing. And so we had only a very brief question about this. But what we did notice is that there is an influence of the media, but media isn't equally accessible from a gender perspective, and women had less access to that media. So they are influenced by something different with their ideas around food safety. So this just needs to be more explored, at least in our data. So others may have looked into that more deeply, but the way that men and women are, at least from a binary perspective right now, are thinking about food safety may or may not be the same. And the way that they elaborated, the women tended to focus more on sort of the local, whereas men sort of were more outward toward what was coming in from the media.
Okay, great, thank you. We're nearly to the end of our time. Any other questions or comments that people want to contribute? Okay. Well, thank you very much to all of our presenters, to Sylvia and Abel and the others who've organized this webinar. This is the second in a series of 4. The next one I believe is on March 11. And we look forward to seeing you then. But thank you very much for participating, for your questions and comments, and for your continued good work.